I want to go over something that's very common and happens a lot, and that's pinched nerve. Now, what's a pinched nerve? What causes it? Pinched nerve is a very general term, which means there's a pressure on these nerves coming out of your spine. Could be pressure on the spinal cord, but when we say pinched nerve, we're usually discussing nerves that exit these holes from the spine and feed your arms, legs, basically your whole body, right? So when we say a pinched nerve, that means there is pressure on these nerve roots. Now, there are different things that cause it. The most common one that's discussed is a disc herniation. When this disc is being pressured specifically at the front too often, sitting, lifting, bending, driving, it bulges out, puts pressure on these nerves. The nerve doesn't like pressure. It gets inflamed, starts shooting pain down the arm, down the leg, causes numbness, tingling, discomfort. You may have local pain as well, which is very common. Local back pain, you don't address it, you don't take care of it, then it becomes shooting pain and sciatic pain. Another thing that can cause it is stenosis, which also is actually something that a disc causes. So stenosis basically means this hole is small. There's tightness in that foramina. Disc herniation causes stenosis. But also another thing that causes stenosis is this. You see how if I press this all the way down, this hole gets smaller. That's called foraminal stenosis, caused by degeneration or dehydration of your disc. This usually happens in older age, trauma, overuse, too much pounding or jumping. When that happens, this hole is small, nerve basically can't breathe, it's pinched, there's pressure on it, you get the same symptoms: sciatic pain, radicular pain shooting down the legs, numbness, tingling. Now, all of these have a fix, and the fix is really good rehab program, adjustments, and the biggest thing is decompression. That basically opens up your spine, pulls it, opens up that foramina. It doesn't happen overnight, it takes multiple sessions, but it makes a huge difference when you have a pinched nerve. So if you do, let me know, we may be able to help you out.